Good afternoon, everyone. Thanks for taking the time to join us today. I am Allison Scobber, Consolidated Planning Group, and we are happy to be back with Melissa Dolan and Enable Dental today. We're going to learn about their special needs dentistry practice and some options that you may have available to you. This is a topic that is near and dear to a lot of people's hearts because they have kids with sensory issues or a loved one with sensory issues, and sometimes these necessary medical appointments or dentist appointments can be pretty problematic. So we're excited to be back with Melissa. We did this one time before and we had some technical difficulties. It was all good and then everything fell apart. So anyway, we're claiming that we're not having those issues today. So thank you for that. So I always like to go over just a few housekeeping items. We are in webinar mode today, which means that we can't see you or hear you. Sometimes people listen to these on podcast, so they're actually not seeing the slides. But if you are listening to us on podcast and you would like a copy of these slides, you can email us at contact@cpgcares.net. That's contact@cpgcares.net, and we'll be happy to send you a copy of the slides. Everybody who's registered for today is going to get a copy of the slides and a link to the recording. So I always like to tell people that ahead of time so you know that you don't have to write every single thing down that you hear, because you are going to get a copy of those slides. And then all of our webinars live on our YouTube channel after the fact. Consolidated Planning Group has a YouTube channel called Consolidated Planning Group, and it is out there really designed to help and empower you as you embark on the journey of planning for your loved one with a disability. There are a variety of topics. There are over 400 webinars out there. So if you've missed one, you can go out to that YouTube channel. You can subscribe for free and find the topic that you missed that you wanted to hear. Consolidated Planning Group is a holistic special needs financial planning firm. We're nationally certified as Social Security advisors, members of the Special Needs Planning Academy. Our whole plan of our firm is working with individuals, families that have a loved one with a disability that may have care needs the rest of their life, not just the rest of our life. I come to you as a parent. I eat, sleep, and breathe this both personally and professionally. And I would say, you guys may have heard me say this before. If you're joining for the first time, we're glad you're here. And certainly if you're a serial attender, you attend a lot of our webinars, we're certainly glad you're back. But these webinars and these advocacy webinars were born out of my own frustration as a parent when my kids were transitioning into adulthood on why is everything so hard? Why do I have to feel afraid that I'm going to mess something up and lose benefits? What do I have to make sure that we're on? And what do I make sure that I don't do or say to mess things up? And so, even though this is what I do and I eat, sleep, and breathe this, I found it unnecessarily difficult when transitioning with my own kids. And so that was kind of how that YouTube channel was born. So I hope it will be helpful for you. We partner with other organizations, attorneys, professionals, people from Health and Human Services, Social Security Administration, to bring you accurate data so you can feel empowered to navigate some of these challenges on your own. And not feel defeated, which so many parents often feel like, because it is hard. It's not just you, it is hard. So we help solve issues like who's going to care for your child when you're gone. We help develop future care plans. We do a lot of talking about transition and what happens after high school. What happens when you can no longer care for your loved one and they can't live in your home anymore. So we talk about a lot of these things on a pretty regular basis and help you develop a plan specifically tailored for you. We put in place protection plans, lifetime care plans, ABLE accounts, and of course, we do a lot of advocacy. We always like to remind people that your situation is specialized. When you have a loved one with a disability, your situation is specialized, and it is really, truly important that you work with a specialist. Whether you're talking about money in the right buckets and preserving eligibility for state and federally funded programs, or you're talking about your legal documents, you want to work with a professional that is nuanced and special needs to preserve that eligibility, and to also make sure that your legal documents have the proper wording and disclosures and the things that are necessary for them to be considered valid in the eyes of some of the government entities. So having said that, I am again happy to be here with Melissa Dolan. Melissa, tell us about yourself and tell us about Enable Dental. And also everyone, if you have questions today, just as always, just put them in the chat box and we're going to get through them just as many as we can. And to get today, we will go an hour or less. So if you're planning your lunch hour or whatever you're doing, just know that we will be done within the course of this hour. So thank you.
Allison, thank you for the introduction. Everyone, thank you for joining us today. My name is Melissa Dolan. I'm the Community Relations Manager for the IDD department with Enable Dental. I oversee the state of Texas. However, we are in multiple different states across the U.S. and are continuing to expand. My role specifically is to go out into the field and build partnerships with other companies that are out there that support the IDD community, whether it's individual families, host homes, um, all sorts of different companies that contribute to the community. Just like Allison said, I also eat, sleep, and live and breathe this. I'm also a parent of a special needs child, so not only professionally do I work towards making things easier for all of us as parents and professionals. But on a personal note, this is extremely important to me. With Enable Dental, I mean, as the slide reads, for individuals with mild to more profound IDD, we're here to help. We understand that there is a large diversity in the IDD community. We With that being said, that allows us to provide more effective care, more support, inclusion. If you've met one individual with IDD, you have met one individual with IDD. So it's very important, as the note states, that every individual with IDD is unique and we approach each one based on their specific needs, their specific abilities, just different factors. And we adjust to their world, not the other way around. Unfortunately, this world was not created. It's not set for the IDD community. So we change what we can do to make things easier for them. But we can move to the next slide, Allison. What sets Enable apart? We have very flexible scheduling. We do like to set things in stone the best we can. However, when we have to move things around, it's a lot easier. We understand that there's other providers, other doctor's appointments, other transportation. So we have for very flexible scheduling. And we also accommodate various settings. This includes private homes, day programs, group homes, foster cares. And with that, it really does help minimize the disruption of all these individuals' days, because if we all know, routine and structure is very important. My son is autistic, and if I waver from what we do on a daily basis, it's difficult. So we want to avoid as many disruptions as possible. With that being said, we minimize our appointments instead of having, like, if you and I were to go to the dentist, you see the dentist or you see the hygienist first and then the dentist. The dentist does everything. That way we can minimize the appointments. We're not coming too often. We're not disrupting the schedules or anything else that y'all already have set. And we come to the clients. So that's a huge thing that's offloaded off of whether it's a company that's providing services such as a day hab, host home, group home, private residence. We come to you because that can also be very anxiety inducing for any individual having to get in the car and their minds are thinking about what's going to happen. Like, you might tell them we're going here, and then go into a new environment where there's more noises, more smells, different people, a lot happening. So we adapt to their environment, not the other way around.
So I have a couple of questions. I think that this is so cool and such a great concept that you go to people, go to their school or their setting or their home setting. Is Enable Dental across the country? Is it, where are you guys based out of? And I think that this is such a cool idea because, people are comfortable in their own space. And when we have kids with sensory issues or big issues with the dentist, which some of us have, I think it helps towards their comfort and their comfort level, being able to come to them. So tell us a little bit more about Enable Dental.
So where we are located, we're located in all the major in Texas specifically in all the major markets. So we have a corporate office in Dallas, San Antonio, Houston, Austin, and Lubbock. All of our providers travel about a 3-hour radius. So um, pick a central location. We basically cover the entire state of Texas. We're not quite far west yet as far as Texas is concerned, but we are in additional states. We are in California, we're in Missouri, we are in New York, we're in Florida, we're in Tennessee. We're in quite a few different states. We're starting to expand. We're going to be in Ohio. I believe we're already in Oregon. So the goal is to be a nationwide company. I do believe later down in the slides, there is a map, but on our website, it breaks it down a little bit better. I'm over Texas specifically, so everything filters through me. Texas is my baby, so I make sure that I get out there, and whether it's just to go out and let people know that we're a resource and available to the community, or work with a company, I go out and help them with their clients to onboard. Sometimes I've even had the pleasure of going to a private residence or two or group home, and I I love that. It's very rewarding. I mean, like I said, I have a son with special needs, so getting entrusting me to be able to come into their home, group home, host home, the day have, it's very rewarding. But we travel all over. We don't have a huge van as far as we do not put, we don't bring the clients out. When I say we come into their environment, all of our equipment is specialized equipment, from our x-ray machine, from our hand pieces, what we use to clean the teeth, everything is specialized, so that we come to them. We are not disrupting their environment in any way. As far as scheduling is concerned, like I had previously said, we are very flexible. However, we try to give as much notice as possible when we create events. Usually, if we have an event scheduled, whether it's with a company or maybe a family, we try to set out at least 8 weeks ahead of time, or we can get them in sooner. That's where the flexibility comes in. But I usually check in about 8 to 5 weeks before we were to go to maybe a host home or a group home or a day have, because lots of things can change. I mean, we have clientele that we have scheduled to see on the 6th of August, and they've requested a later date, and it's as simple as just communication. We have to work together to make a difference and to collaborate and ensure these clients get the care that they need. So communication is extremely important, as everybody knows, when it comes to any type of clinical care. But within Enable, we really try to make sure that we're accommodating not only the clients but also the caregivers, because right now, short staffed is a thing as far as in day habs and group homes, et cetera. And we are aware of that. And that also helps a lot of the companies as well, because they also don't have to worry about if they aren't going to have enough individuals for some clients that have a higher level of need. So we're not taking away from other individuals because we need, somebody to come with the client that needs to see the dentist. So all in all, it's a huge stress reliever, given the fact that we come to see the patients. So far, I have had the opportunity to really connect with a lot of families and patients. It's been very rewarding. I connected with a mom recently, and anytime I talk to families, I tell them my story. I share that. I think it's important to connect with individuals to let them know that I understand they're nervous. It's nerve-wracking allowing a new provider. Trust is important. Gaining that relationship is important. So as far as families are concerned, I have heard nothing but good things, and excited about us coming. We recently onboarded a new client, and the mom has been trying to transport her child for the last couple months and driving 2 hours for services every time she had to go. And I mean, it's a huge stress reliever. I know as a mom, that would definitely take a lot off my plate. As far as our clients that we partner with, that too, same thing. As far as us stepping in and helping with paperwork, that allows the nurses, the caregivers to be more present, to really interact with the clients and ensure that they're getting what they specifically need while they're under their supervision. And we're not pulling away from what they need to take care of. Patients, it's another rewarding thing. We are focused on getting to know the clients, and I think that's a really positive thing because we have heard from a lot of families and clients that um, IV sedation. Every dentist they take to them they have to be IV sedated. And IV sedation does not mean that the dentist specializes in special needs dentistry at all. Um, so we take the time to get to know the clients. We've had one client that for years had to have IV sedation, and the company we partner with wanted to try us out. All it took was us to talk to him about Charlie Brown, to get to know him, and we've been seeing him for almost a year now, and he has never had to be sedated at all with us. So
Okay, so I need you to back up on a couple of things. I want to get some clarification. So the bottom line is so some of these families, clearly their kids do need sedation because it's such a traumatic experience for the kid, they can't take it.
mhm.
So Enable Dental, you're mobile, a mobile dental, and you do have the ability for sedation that can be scheduled should that be the case and what the person needs. You guys do have the ability to do that.
So with sedation, we do not do IV sedation. We only do oral sedation. So it would
Okay.
depend on the client whether they are already on something, PRN, or if the doctor felt that they needed something. We do rely on the clinical staff and we listen to the parents because they know their kids best. But I will say our clinicians are specialized in behavior management, communication barriers, sensory sensitivities. On our new patient consent forms, we have a spot that actually asks questions about the client specifically. So when we're coming in, we know what they do like, what they don't like. Do loud noises bother them? Are they verbal? Are they not verbal? So we take the extra initiative to really get to know the client and take that time to build the trust. So if IV sedation is required, I will work with the families to make sure that we locate a specific location that will take care of their loved one. We are not going just to be like, oh, we don't do that and leave
Sure.
you out in the cold. I've experienced that personally with my son recently. It took me 4 months to find um, an oral surgeon. My son has to be put in a hospital setting for wisdom teeth removal. And I kept hitting brick walls because everyone was like, oh, we don't do that. We don't do that. But we don't do IV sedation at Enable, but we are not going to just step aside and be like, sorry, we don't do that. So it,
Perfect. And I think we had a question in the chat box, and I think this is a big factor for all families. I mean, all families that have dental insurance, they want to know, do you take dental insurance? And also the other question is do you take Medicaid? And just for the families that might be listening in today that are getting the HCS waiver, there is a $2,000 dental Medicaid benefit. So tell us what insurance you guys take, because again, obviously if we can use insurance and use your services as opposed to pay for out of pocket, that would be ideal.
So we are not currently a Medicaid provider. We are in talks with Medicaid with the state to get our providers credentialed. It is a task, so it is an ongoing back and forth between ourselves and state, but hopefully one day that will be an option through us, but presently no. We do bill through the HCS waivers, Texas Home Living class, and I don't believe I'm missing one. That's correct. I'm not missing one. I apologize. We do
Maybe
accept private.
MDCP,
Oh,
but okay.
oh, I'm sorry, Allison. Did I?
Maybe MDCP.
Oh, okay. We do accept private pay. As far as private insurances are concerned, we do not bill any private insurances quite yet. We have recently partnered with United Healthcare, Cigna, Liberty, and I think WellPoint, but I believe Liberty and WellPoint are the same. We're also expanding into Medicare Advantage plans. So if any clients are dual coverage, if they have Medicaid and Medicare, there is a possibility that we take one of their plans. So as far as those kind of situations are concerned, we would just have to run their benefits and see. But we are slowly but surely expanding our network as far as what we are able to bill outside of the HCS waivers. And with that being said, with those specifically, we are very aware and pay close attention to those funds, how we utilize them, because they are only, it's an annual thing. So we, as far as the funds are concerned, we keep track of those to not go over. Our dentist make sure that they treatment plan, they phase things out based on level of need. So we're utilizing those funds appropriately. Private insurances, like I said, we don't take presently at this time, but we will help the families if they still want to move forward with us and pay out of pocket. We will assist filling out the insurance forms that they could submit to their private insurance and see if they could be reimbursed for our services.
So, because
Um,
sometimes a lot of dental plans don't always have a network. People are asking if you're taking Blue Cross Blue Shield PPO. Then there was the Star Kids, which is Medicaid. And then there's a question about TRICARE, which is military or government. And then basically a question, and I'm sure that this is a broad question, but let's just say it's a generalized cleaning and there's no sedation. And what would the out-of-pocket costs be looking like if they were private paying for your services? Could you provide a range of what they would be looking for? So I know that was a mouthful. First off, because there was several of them. Blue Cross Blue Shield, is that a coverage that you take?
So you said Blue Cross Blue Shield, TRICARE, and Star Plus. So Star Plus, Medicaid at this time, no. We do not currently bill TRICARE or Blue Cross Blue Shield, but I'm glad that they brought that up because that's something that I can bring to my business development team because like I said, we are slowly but surely taking on new insurances and I don't know at this time if that's something that's potentially in discussion, but I'm glad that that was brought up because then I can bring it to our business development team and see what we can do about that.
I would
As
like
far
to
as
add Emeritus Dental, Delta Dental, United Healthcare Dental. Any of those that you take?
we are partnered with United Healthcare.
Okay,
So we would just have to check their benefits to see if we fall under whatever plan they might have.
okay,
Um,
perfect.
but the other two presently not at this time, but slowly but surely that is the goal. That we're a very wide variety provider so that, because let's be honest, Texas benefits as far as dental's concerned in the IDD community is it's rough. It's difficult. So we're doing everything that we can to try to accommodate families, clientele that we partner with. We recently came up with a plan for ICF clients that are associated with, companies that provide services. It is this is not just for private pay, but ICF is required to follow certain state guidelines. So we created a new program that's listed on our website. It's an annual fee. It is $8.99, but it does cover multiple services, and then an additional 20% discount is applied to any treatment. Um, if there's a family that wants to pay privately, the first initial appointment is $283. That covers a full set of x-rays and a dental exam. We do try to do a full cleaning and fluoride treatment at the first appointment, but again, it's really going to depend on the client, what they're comfortable with. There are times we schedule patients and it ends up just us visiting with them. So we will not bill for anything until we are able to actually accomplish that service. But if we are able to do those four things that we typically try to do or attempt to do the first visit, it's around $412 for the cleaning, for the x-rays, the exam, and fluoride. It's about $412.
So about 412 for everything included, and basically the cleaning, I think you said 283 or 238. Somebody
Yeah,
asked.
without the cleaning and the fluoride is 283, and the 283 covers a full set of x-rays, like we were onboarding brand new patients. So it'd be a full set of x-rays and a comprehensive dental exam. With the cleaning and fluoride, it would be 412.
Okay, got it. Perfect. Thank you.
Mhm. Um, but going on to the next slide, I think we've kind of touched on a lot of this. I mean, all of our services, oop, can, we went on billing. Oh, thank you, Allison. Well, all of our services can be conducted in either an at-home or on-site environment, so we can provide great care in a familiar, comfortable environment for our IDD community. Our professionals are highly skilled and qualified to provide a range of dental services. We do everything. So we're not just a one-stop shop. It's not just cleanings and x-rays. We do fillings, we do extractions, partials, dentures, night guards. We do everything. So it's not just preventative. We do use, like I said, state of the art. All of our equipment is specialized. We bring it into the facility. Um, our team that we work with, they are compassionate, and they want to meet every individual in their world. So that goes back to the consent forms. We want to know about the clients. We have a client, like I said, talk to him about Charlie Brown and we can do anything. We have another client that loves moon pies. You give him a moon pie and he'll sit there forever. It just really depends. But more than anything, it's about building trust with the clients, with the patients, with the families, because we need to work together to make a difference. We can't operate as separate entities and really make a difference in the IDD community. So what it comes down to is, being compassionate and having that personalized care, clear communication, building trust. But just like the last thing said, we work closely with everybody, including the physicians as well. So before we do anything, we check their meds. If we need to prescribe them anything, if they have to have blood thinners held or anything, we communicate with their PCP to ensure that we're not doing anything or overstepping or causing any issues when it comes to their already set care plan that they have in place. So we can.
Um, a couple of questions. This is a great question, and I don't think we covered this. As far as age range, do you also take geriatric patients, so from pediatric to geriatric, or is there an ideal age range that you typically tend to work with?
There is no age range. We actually provide a lot of care to a lot of different verticals. We go to skilled nursing facilities, we go to assisted living, we go to private residents, we go to group homes, day habs, fosters care. But specifically with the IDD community, we have a patient, I think one of our oldest patients is almost 80. And then we have some 16-year-old, 17. We're actually working with a nonprofit in the Austin area to potentially even see little wee ones, because it's hard for parents to take off time and take their babies out. So there's no real, just kind of like IDD, there's no one size fits all. Like, we want to be able to adapt to the IDD community, not them have to adapt themselves to the world that we exist in. Um, Billing.
So,
Oh, go ahead.
um, I know that we talked a lot about the billing. I think we had one outside question. If a person needed oral sedation, is there additional charge for that, for the oral sedation? Um,
No, so we do not charge. We don't charge to come out. We don't charge for oral sedation. And like I had mentioned previously, if we come out and we have a patient scheduled and we're not able to do anything, we're not going to bill for that. Whether it's through a client that we partnered with or a family, we're not going to charge you for that. We've had clients that has taken maybe 2 or 3 times for us to be able to do anything, but that's okay. We're on their timeline. So if we go to see someone and we're supposed to do x-rays, exam, cleaning, etc., and we're not able to do that, um, that's okay. We're going to try again. Or if we're only able to look in their mouths or we're only able to do x-rays, we are only going to bill for what we are able, the services that we provide. So there's no travel fee, no additional cost for oral sedation. No. Mm-mm.
That's awesome. So as far as Medicaid is concerned, straight up Medicaid, you guys are working on, it's in progress, but you do bill directly through these Texas Medicaid waivers, HCS, Texas Home Living, ICF clients. And the other question was, is class included in this, the class
Yes.
waiver?
Yes,
Okay.
classes, yes.
Okay, awesome. So that answers that question. Let me see. We did answer that we do go to private homes. It doesn't have to be a group home setting. Do you guys accept Apple Pay, Google Pay, and all credit cards, or do they have to pay by debit card or electronic check for private pay?
No, we accept all forms of payment. So, if it is a private pay, we would just connect with the billing department who whichever market the individual might be living in, and they would be able to assist with those payments. But there's no specific, we accept all forms of payment. Yes, ma'am.
And so if a family is on here and they have XYZ dental and they are interested in you being in network with their dental, then they could reach out to you and express who that is, and you guys can make a decision on kind of adding some of those. I do know, and I want you guys to check with your dental, the audience, check with your dental. A lot of dental plans, like Medicaid waivers might be a little bit different, but a lot of generalized dental plans, they do have out of network coverage, or, that you can go wherever you want. It might just be slightly higher, or, slightly less than what they will pay. So that is just definitely worth looking into. But how, because you guys are planning on expanding your insurance offerings, are you guys open to those communications from people that may have interest? I mean, I'm thinking of big providers like Emeritus Dental, like Delta Dental, like the Blue Cross Blue
Absolutely.
Shield of Texas, United Healthcare. Those are the big ones that come to mind. I'm sure you guys have other ones too, in mind. Those are the big ones that usually rise up
Yeah,
over and
no,
over.
absolutely. Like anybody, any family, any clientele, I mean, I would love for them to reach out and say, this is what my loved one has, this is what I have, etc., so that I could bring that to our business development team. Because, like I said, as far as dental is concerned, I mean, it's extremely, everybody knows your mouth is an international highway to your bloodstream. And the geriatric population and IDD community is the most underserved population when it comes to dental. And I mean, it's disheartening, and we are really working hard on improving things for the IDD community. Dr. Suter, who's one of our boards of directors, I mean, he's working with state legislator. Like, we are doing everything that we can at the top tier to be able to try to make a difference. Unfortunately, things don't happen overnight, but any we have, like I said, we have to work together. There's probably people on this call that know things that I don't know, and we have to share information to make a difference.
For
So
sure.
yes, please,
Yeah,
definitely.
I think that is great, and I love that you can go into the facilities and the group homes or some of the other places like that. And I think of nursing homes and things like that, because a lot of times those are the places that they're getting the least, if any, dental care at all. So I love the mobility of your practice, and you guys are definitely kind of second to none on that. Um, Okay, so for people, we're gonna have her contact information. So people that are wanting quotes like cleaning and wisdom teeth removed or other things like that, you can reach out. We're gonna have all of her contact information is on the beginning of the slides. Where and Melissa, if you want to go ahead and put your contact information in the chat box as
Course.
well. And they'll be happy to provide you a quote is what for what is needed. I actually have one other question that we didn't discuss, and I'm sorry if you guys don't do this, but a lot of teenagers need braces. What about orthodontics? Do you guys refer out to that for that, or what do you do with orthodontics?
So we would refer out, same thing with kind of IV sedation. But I would be Actually, I guess I would be acting as the liaison between the family and whoever we would refer to. So again, if we don't provide a service, which would be ortho, and we do not do IV sedation, but that goes along with saying is that we won't know if we can't accomplish something unless we try. We won't bill for something we can't accomplish. So I have a lot of families that reach out and say that they have been told, or their loved one has a history of IV sedation, because that's just what has been happening. And sometimes at the end of the day, that isn't what is required. But of course, we want to make sure that everybody's safe. We want to make sure the patient's safe, we're safe. So if there is a service required that we cannot accommodate, I would be working closely with the company, clientele, with the family to find the right fit for their loved one.
I love that. I love that it is so personalized. One person said, if the patient won't take medicine by mouth for oral sedation, are you able to provide laughing gas or a shot, or would that be a referral out?
So that would have to, if they needed, besides oral sedation, if they need anything aside from that, if they needed gas, if they needed IV sedation, anything like that. I mean, we do anesthetic, like we'll numb the gum just like at a normal dentist office, but if they need something other than an oral pill, we would have to we'd have to refer out. But I am very proud of the providers that we work with. I was actually present when we met the sweet gentleman that loves Charlie Brown, and the nurses were like, "Oh, we really hope this works because we've been having to drive to Abilene, which is 2 hours both ways for him to see a dentist." And like I said, all it took was getting to know him. So we approach each individual just as that. Again, we all want to be safe, and if they require something that we cannot provide, we will help you find the provider that can. But I really think it's important to try because we don't want to put anybody in a box. So, but yeah, we
I think of customized and personalized solutions, which is what we provide here also at CPG. And I think customized and personalized solutions are important, like you said at the beginning. Every person is an individual, and every case is different. Every person's experience. Somebody may have had a terrible experience in the dentist in the past, so they're scared to death. You never know. But I love how personalized you guys are with all of this. So what for today, again, it's been Melissa Dolan with Enable Dental. She has put her contact information in the chat box. Everybody that has signed up is going to get a copy of the slides and her contact information, and you can reach out directly about your personalized questions that you have for your loved one. And she's put her email address out here as well. And guys, wait, as always, we always want to talk about keeping things on your radar. The whole point of a lot of these webinars is just advocacy. It's just knowing, hey, what are the next steps that you need to do? What are some things out there maybe you should check into that are worth knowing about? Like, this is awesome. I think this is awesome. Why didn't somebody think about this 35 years ago? So knowing that this is out there and that you have options available to you to come to you for these services is great. We do a variety of webinars every single week, every single year, on a variety of topics on planning for special needs. But if you have a loved one that is transitioning, and transitioning can be a lot of things. It could be transitioning into adulthood. It could be transitioning out of their primary residence into a group setting or a residential setting because a caregiver can no longer provide the caregiving services that they once did. We've got a lot of webinars on these topics and how to and kind of navigating these. But these, developing a comprehensive special needs care plan, what I invite people to do is really think about these things, which I know you are because you're here, right? Thinking about these things and having a plan and working your plan and not waiting for the crisis to happen. Literally this week in our practice, we had a lady that passed away. We got notified about it that she had passed away. Her sister had passed away the week before, and her brother died last night. So in the course of 2 weeks, 3 people passed away. So that's a crisis. That's a big crisis. So whether it's a heart attack or a stroke or something happens to somebody and they become incapacitated, they don't have the ability to speak or say or do the things that they once did. It's so important that we have these conversations now when people are of sound mind and body and not waiting for these things to happen. Because the thing is, our kids with intellectual disabilities, our kids that are neurodiverse, they think differently, their brains are differently, frontal lobe issues, What they have in common is these kids and are adults with disabilities. What they have in common is the change. When their apple cart is upset, they're upset. It's hard. And so easing into these things or these concepts or these ideas with our loved ones that struggle with change, it's really, really important. So I just invite you guys to the YouTube channel. You're going to get this link and it's going to have our upcoming webinars that'll be coming up over the next month or two. And you can sign up for the topics that are of interest to you. They're always on Zoom and they are always free. We work on a collaborative team here at CPG. So if we choose to work together, yes, you'll get me, but you'll get other members of our team as well. We have an awesome team over here. We always do free personalized consultations. So it costs you nothing to learn more about CPG, how we work, and how we might complement the planning that you have done so far for your family. We're not here to rain on any good plans that you already have in place. We're here to build on the foundation that you've already established, help you establish a foundation, or pick up where you left off. Because usually somewhere in between is where you are on that. We got started, or we had good intentions, or we did a lot a long time ago and probably it needs to be reviewed. We do a lot of second opinions or a look under the hood of what do you already have in place? How do we preserve eligibility for state and federally funded programs? How do we make sure that your loved one is getting what they should be getting as far as those programs are concerned? So this QR code on the screen will take you to our calendar where you can schedule our free personalized consultation. And that is designed for us to learn a little bit more about you. You learn a little bit more about us, and together we can decide if it makes sense for us to continue talking. But we stand ready to help. It is my heart to help you navigate this. As I said, our YouTube channel, the webinars that we do are by way of advocacy. We just want that. We want you to feel empowered, that you have the tools and resources that you need to be successful and not defeated because you start reading all this stuff and you start listening to all this stuff and all the things you shouldn't do, and oh, you did that, oh well, now you're going to lose XYZ that you worked so hard to get. It's tough, but we can help you navigate all of that and maybe uncover some additional programs that you didn't know were out there. So Melissa, it has certainly been my pleasure. I'm excited about Enable Dental. I love what you guys are doing, and I really appreciate you taking the time to come back with us and join us again and share your program with us.
Well, thank you for having me again. I'm so glad that it went really good this time. Thank you, everyone who joined. Just like Allison said, I mean, we have to advocate for those who cannot advocate for themselves, and it starts by us working together as a resource out in the community. So even if you are looking for any other services outside of dental, we have to work together. I have difficulty finding resources like she just touched on. Like, it's a lot of information. I'm a mom of a special needs child, and you can Google all day, but connection is what's most important. So, but thank you all for being here. Thank you for having me, Allison. I
It
appreciate
was
it.
wonderful, and we look forward to connecting with you again soon. Guys, don't forget to reach out to Melissa and ask her specifically about your loved one. Thanks so much, everyone. Have a great afternoon. Bye now.